Welcome and thanks for coming to our Fountain of Life Fitness training program. As usual, we're going to start out with alignment work to make our body in the best order we can prior to applying forces of load. So if you could start out with a massage, if you have a tennis ball or a cross ball, it's a massage ball. It's a little more sticky. The massage balls, they can have the little like pieces sticking out of them also. They're a little spiky, those work really well. But we always work on the pecs, the chest muscles right here in the chest. And the head should be turned away from the ball and angled slightly down so that you don't strain the neck. It's easier to get yourself in place in a door frame. And you'd like to work the length between the corner of your collarbone and the chest bone, the clavicle and the sternum. And if you can work your way out toward the edge by the shoulder, right by the underarm area, where your pec tendons attach up into the rotator cuff area of your arm. These will always tighten up because we're people with eyes in front of our head, so our arms are reaching forward all the time. So this is something that needs to be done regularly. Okay, and the other way. So when you're in a door frame, you can get the arm out to the side, get a little more comfortable angle here. Okay, and then under the arm, right by the chest bone, all those lengths. Okay, another area that of course we all need to work on is our feet. So if you could just massage at the bottoms of the feet. There is an arch in your forefoot. You can see that in babies' feet, when they crinkle up their toes, you can see that arch lift. As we get older, that often drops down, and then people get the pain. They get the base of in the forefoot, often by the second or third toe. And the outside of the foot also has an arch, and then of course the medial arch in the middle. Okay, and the other foot. So every day in our training, we'll do alignment work first. This is currently our regular system. And we'll add in different variations of spine strengthening, foot strengthening, and then focus on one particular muscle group that's kind of a feature area of the week. And our weightlifting program will also vary. There's consistency. It's always full body training, but different exercises weekly. Okay, now we're going to go to the floor, and you'll need a broomstick, a strap for stretching, like a yoga strap, or a karate belt, or a bathroom belt, bathrobe belt, and also the massage ball while we work on the neck and the skull angles. So it'll always, the main objective really of our program overall, building up our bone density. It is a big concern for the population. But that's not just the bones that are the factor. I think weak bones indicate weak muscles, indicate worse health, and most likely to have injuries and also more prone to other health consequences. Okay, so we've been starting on the upper trapezius muscle. And I like to start here on the left side, if you would like to join me. So the upper traps are just here at the base of the neck. I'm starting on the left, base of the neck, and slightly to the left and slightly back. And if you bring the left arm up, you can just put some pressure. Commonly, this muscle here gets, really hardened and thickened. And if you regularly work it out like this, it feels significantly better. You can turn your head and lift your arm. So you can either go side to side over it and like crunch or crackle a little, or just put pressure down. Now, if you take the ball slightly further to the side and bring the arm up so you can feel the bony edge of your shoulder blade, and then more near the top though, not down the back so much. So this is the tendons also of your upper traps. And if you can work along the edge of the shoulder blade, it cannot, I mean, it's often very sharp. But there again, you'll get that tendon. It might be quite stringy, and just put a little pressure to decompress, which will allow your shoulder blade to move more comfortably. Okay, now we'll do the same thing on the right side. So I'd like to have that leg straight and the ball just in the back of the upper traps, the belly of the muscle. Bring the right arm up. And you might put pressure or move across fiber. And some people, actually quite often, one side will be, thicker and harder, the other side almost nothing happening. Muscle maybe is more developed on one side when your shoulders, if you have a high shoulder, but doing this will help even you out. Okay, and then take the ball a bit more to the side and slightly more down so you can feel the shoulder blade edge. And here, find that spot where you can feel it's a bit sensitive. Earlier today, someone had been working in the kitchen and cooking for a long time, and so lower back was a bit sore and stiff. And if you're in a kitchen leaning forward, and especially the oven, leaning down, pick things up like that, the hips will get tight and a bit sore, and that will cause referred back pain. So next, if you take the ball in the left hand and lift the left up a little, hip up just a bit, put the ball down, then straighten the left leg, okay, and then turn up on top of the ball. So here she was really sore, like in her glutes, and this particularly is the tendon attachments of your glutes to your leg. And so when you work on it like this, you can just put pressure or move around. It will allow your femur, your leg bone, to sit properly in the hip socket. And we're going to do a few exercises for that purpose today. Okay, now we'll switch to the right hip. So lift the hip up just a little and right leg straight. And lift up on top of the ball. And let the ball just sit right into that socket of your hip joint. Commonly here, the right hip is more tight and more sore than the left. And I would say most frequently I see the left shoulder, the upper traps are tighter and harder. So there's that diagonal, very common right hip to left shoulder. Diagonal vector. Okay, so then we'll put the ball now in the back of the head. And this is just a really simple way to decompress your spine. So we all know we have vertebrae in our backs. We're aware of that. You can see them even. Arms by the sides. And when you're resting like this, that will allow the vertebrae to relax and separate and find their proper position. Okay, and now nodding up and down. And keeping the chin down, take a deep breath, a long, slow, deep breath. And again, nodding. And a long, slow, deep breath. And now why we do this angle? So the ball should be in your skull, not in your neck, in the back of the skull. So this will help the suboccipital muscles in the back of the neck. They get tight from our heads going forward, okay? And the neck can be either too curved or just angled forward. But regardless, we want the neck to sit at the proper curvature. And now only with your eyes, if you could look up and down. Same thing when you're moving the eyes like this, it helps the suboccipital muscles in your neck. And take a breath. Okay, eyes up and down. And a breath. Okay, so now we'll put the ball away in the strap. So the strap, I put it in the right foot. So here we're not just trying to feel a good stretch. Not really. We want the joints to be optimally healthy. So it's in the right foot. Take the strap in the left hand and wrap it around the calf, the back of the calf of the right leg. And now hold on to the strap with the right hand. And then keep your leg really stiff. So your knee isn't twisting and your ankle, they're really stiff like a stick. But your femur is rotating in the socket of your hip joint. And it should feel very clear, like no restrictions. You know, everybody will have a little different range in and out, but there shouldn't really be any pain. Unwind the strap and just pull. If you do have pain, I mean, the point of our training is to help regenerate those tissues and strengthen and mobilize, so you're in the right place. Then switch to the left foot. Right leg is down. The strap in the right hand, take it around the back of the leg, the calf, and hold on to the left hand. And then just rotating the leg. Unwind the strap. So when I do this, I like to have to keep the knee over the hip and stretch so that you don't feel it behind your knee joint. If you feel the back of your knee, just bend your knee. You never want to overstretch the back of the knee. Then strap down. And broomstick in the back of the right leg, and then the front of the left leg. The stick shouldn't be right behind the knee joint, should be up in the hamstrings a little. Here you're evening out the pelvis, and you just press the legs into the bar, keeping the back of the hips centered. Lower back should have a slight arch. Switch the leg position, that's a neutral spine angle. We're always striving towards a neutral spine. So you press the legs, lower back, don't flatten it down into the floor. Just a small arch in lower back. But do keep the chin toward the throat. Okay, then we'll put that down. Next, we'll take the arms out in a Y position here, palms up. And if you have tight pecs or shoulder issues, you might not get to a Y. Your arms might be like a T or even down more by the sides. That's okay. But palms face up. And then a cradle rock position. So you imagine you have a stability ball on your abdomen and you wrap arms and legs around it. Now brace the abs. Not your neck should be relaxed. Shoulders are relaxed. We're going to rock side to side here. And as you do that, you maintain your good core control. If your back is arching as you're rocking to the sides, the core is core rotational stabilizers, so we want to work on that in our training. But you might just hold the metal position for now. Really should be one stable unit. Okay, then arms and legs are down. Okay, arms up to the sky, then bend the elbows 90 degrees. And the knees are over the hips. So here you should feel your abs automatically engage. Don't flatten the lower back to the floor. You have neutral spine angle. Right leg forward a couple of inches, hold. You don't need to straighten the leg, but you should feel your abs, not your legs. Right leg back. This is not a quad strengthening exercise. Left leg forward. This is for your abs. So your thigh shouldn't really feel like it's doing the work for you. Left leg back. Right leg. Keep the chin toward the throat, but shoulders and neck are quite relaxed here. And left leg. This is our core activation drill. So when we do our weightlifting, our abs will be engaged properly. Okay, then spine rotation. Right leg is straight. Turn on to the right side. Left hand, reach toward your right foot. Right hand, hold on to the left knee at the front. Now, importantly, your left shoulder should be back and the left knee forward. Both are the same distances from the floor. Make sure you don't just roll the knee all the way forward. Keep yourself even with the shoulder back and knee forward. Okay, turn onto the back, left leg is straight. And that right knee comes around. So you're lying on the left side. Right hand reach toward the left foot. You might have to engage your glutes to prevent hamstrings tightening up. Left hand on the right knee. If your hamstrings cramp, indicates a mistiming, the sequencing. You're using hamstrings before glutes. So just activating glutes usually remedies that situation. Okay, down. Then we're going to start again with the strap under the right foot. This time we're just going to do the stretch. So knee over the hip for everybody. If you, in that angle, if you feel the back of your knee stretching too much, then I would bend the knee a little. And you can stretch your calf, your Achilles, but not the back of your knee joint. Switch left leg. To angle the leg correctly, your knee and toes should be pointing back in the direction of the shoulder. Some people twist their ankle a bit or the knee is rotated out, so it should be pointing straight back. Okay, then strap away. And broomstick here. Okay, so in the hamstrings of the right leg and the quads of the left leg. Knees 90 degree. Arms are straight and chin down. So this balances the pelvic girdle, your pelvis, the shoulder girdle. You can feel the shoulder blades, the collarbone, your arms. Keep the chin down, lengthening the spine. Reverse the legs. This is just a hold to get yourself in better alignment. We want to organize our bodies before we load. Okay, and broomstick away. When you take the arms here in your Y angle, you'll notice how it feels a lot better. You've got better blood flow down the arms, and your nerves to your fingers are working better. So arms and legs up in the cradle rock angle again, and this time we're just going to rock over to the left side and hold. And you'll find that place where it's very stable, where your body is centered with the force of gravity, aligned. And we'll rock to the other side. And it's just really effortless to be there. And center. And relax down. So arms up to the sky, bend the elbows and legs up. Knees over hips. Right leg a little forward. So this is Kolar dead bug. Right leg back, left leg forward. Kolar is a researcher, I think he was Czech. Left leg back, right leg, who did research on infants, children, and the dynamic neuromuscular stabilization. Left leg forward. So this exercise, yes, you feel your abs, but it helps you to dynamically, when you're moving, your nerves and muscles will work together to keep you stable. Legs down. Okay, right leg is straight. Turn onto the right side, left hand, and reach toward your right foot. This time maybe the hamstring won't cramp. Then even out the shoulder back and the knee forward. Okay, and left leg straight. And we'll turn onto the left side here. Okay, engage your left glutes and right hand reach toward the foot. That generally helps prevent the cramping. Right shoulder back. Right knee forward. Equal and opposite. Okay, and unwind. So for here, we're going to roll out the quads. So you'll need either a foam roller or a rolling pin. If you have a rolling pin, or even with a foam roller, a lot of people don't like to do this face down. So you can just sit up and roll out your quads. So the quads are the front of your legs, the thigh muscles. Of course, it's better for your core training if you do this other version. I would do one leg at a time with both legs. You always hyperextend the lower back. So the ruler is just above the right knee, and we're going to incrementally flush out and clean up the fascia in your quads. If you're new to this, it's usually in the beginning, it can be quite excruciating. And with regularity, it's almost like nothing, like it feels totally fine. So that clearly means that if you do it regularly, your muscles are way healthier. When you come to the top, you want to go on the front of the hip joint and also on the outside of the hip. This is the tensor fascial lateral muscle, TFL, that attaches to your IT band. Okay, and now we'll work the other quad. And why we do this and not everything else, you know, during the day, if you want to, I mean, I have another video of full foam roller massage ball series for an hour. But here we just want to get our training in, so I'm just picking the most important places. Quads always get tight from sitting because we walk forward. And if you don't release your quads before you do your other work, then the quads will just interfere. Okay, so the outside of the hip, make sure you get there. Okay, so from here, we're going to start with spine strengthening exercise. We'll always do something. It'll vary over time. If you have a stability ball, you can use that. If you don't, you can use an Ottoman. For most people, Ottoman is probably better because the stability ball moves around too much. Why should we care about taking care of our spine? Well, the nerves go down your spine, so they help communicate to your body what your body's supposed to do. So you'll prevent injury and be stronger. But if you don't have an Ottoman or a stability ball, instead, you can always do bird dog. So the bird dog option will be like this. We'll go right arm lift. I would do today only right arm lift. So you go like that, right arm lift, and you hold 5 seconds and down. We'll do only right arm, and then next will be only left leg. Hold 5 seconds and down. We're going to here do 2 sets of 7. So that's option 1. You could say bird dog version, right arm lifting. The other version is torso lift. Be careful when you're on something like this that you don't beat up your ribs. So you use your elbows for support. The feet are on the floor, so they're helping you to be stable. Your toes are on the floor, curled under. Hands, if you can't do this, you can have the hands on the floor, but best is under lower back like that. Keep the chin tucked in, everybody. Okay, bird dog group, right arm lift. Other group, you just hinge forward a little, and then lift and hold. The people doing, and then down, lift. If you're doing a torso lift, you don't have to go way down. The action is you're hinging at the hip down a little and lift. You're not bending at the waist. That's really important to understand. You're not bending the lower back. It's more of a hinging action at the hip. So my implement here is restrictive, so I can't do that very well. If you have a ball, it's a lot easier to do. Go down a little and lift. Down a little and lift and hold. The bird dog group, you're just doing right arm lifting and holding. And one more, down and lift and hold. Keep the chin tucked though, don't let your head hang down. Okay, and rest everyone. So next bird dog group is only left leg lifting. The other group, same thing. So what I mean about this one, the spine strengthening here on your ball or Ottoman, that the hinging action, if this is your pelvis, right, this is a hip hinge. This is rounding the lower back. This rounding lower back action, not a good thing for your spine. You want neutral spine. So you just do a bit of a hinging action like that. So the spine is always neutral. Okay, here we go, second set. Bird dog people, left leg. Other group, chin tucked in, everyone. Okay, hands on lower back or on the floor as needed. then hinge and hold, lift and hold, down and lift and hold. The bird dog group, make sure the hips are level across the back, down and lift. The people, if you're lifting the left leg, make sure you don't lift the hip up higher than the right hip, down and lift. And also the bird dog people, the left leg, the toe should be flexed, pointing down, down and lift. 2 more, down and lift. So my angle here, I can't bend down much, but the neutral spine is always consistent. Down and lift. Okay, everybody rest. So next bird dog group is left arm is lifting. And we're doing again 7 reps, 5 seconds. The other group, different position here. So when this time you come over the balls, they move around a lot. That's why I'm suggesting Ottoman. You can get a special support for the ball so it doesn't move around too much. But okay, so hands are like this under the shoulders. And this time both legs are lifting. Like this, both legs lift. And then down. Okay, everybody ready? Shoulders are down from the ears. Press your hands to the floor. Bird dog group, left leg lifting, left arm lifting. Other group, both legs lift and hold. Okay, feet down and lift. The people who are doing the 2-leg lift here, down, brace your lower back. And as you lift, your legs should work in together, right? Simultaneous. Toes down together, lift simultaneous. Everything is sequenced perfectly right and left leg. Brace the lower back down and lift. Notice if you crash down one side, down, or if you initiate with one leg, both legs together. Make sure the head is set, down and lift. 1 more. Okay, rest. Okay, bird dog group. Now right leg is lifting. The group, both legs lift. Same one. Okay, the last set of this back care series. Shoulders are down from the ears. Everybody press into the floor. Eyes are looking straight down into the floor. Okay, either right leg lift or both legs lift and hold. Down and lift. Down and lift. So the bird dog group, right leg should be straight. Down. When you lift the leg should be straight. Down and lift. And everyone, the hips should be level across the back. One hip shouldn't be higher than the other. Down and lift. Here, generally the bird dog group, the lower back right side starts collapsing. So just think about that. Brace your lower back. 1 more. And then rest. So these are very well established, well known exercises for strengthening the spine, helping prevent back pain and back injuries in general. Now we're on the floor, so we're going to do our foot exercise here. So you might just sit up. It's most comfortable if you sit against something, like sit against the wall or sit against the couch, so you can sit up without straining. You don't want to feel this in the front of the legs, okay? What we're going to do today is a toe scrunching. It's not ankle moving, your feet shouldn't be moving around. It's only the toe box. And so this is my preferred sitting position, but it's tough on the shoulders. So you just scrunch the toes, all of them, and then open them. Scrunch and try to spread them apart. scrunch, and spread apart. We're always going to do, as I said, some kind of foot strengthening work. Always some spine strengthening, core strengthening is in everything we do. So try to, don't go too fast, go full scrunching and full releasing both directions, but don't move the ankles around. So this week, if you want to, the foot training is toe scrunches. You do this for 1 minute. We're not going to do it for a minute now because we don't have time for that. But, if you were going to do this as a daily exercise for a week to strengthen your feet and mobilize your feet and rest. A common place where people bend or break bones is in their feet, metatarsal fractures. And the bones are weak, the foot isn't aligned properly, so we need to get circulation. That's what we're doing, getting circulation into those bony structures to help build up your bone density and strength. Okay, so next we're going to do the same thing, but you just scrunch up and hold. You might get cramping like into your arches, but you're scrunching the best you can really hard, that's okay. And then open and spread. See if you can spread. Don't move the ankles though, and don't twist your knees. And try not to use your legs. You're really just working the toes here. Okay, and then scrunch and hold. So first one, doing them more quickly, 1 minute. This one, 1 minute. Open, slow, contracting and expanding. Scrunch and hold. And if you'd like to, go through that cycle twice. Open. And you'll notice after we're done this that your feet feel a lot better before we start doing deadlifts. Open. Okay, and then relax for a moment. And third is this, so you go opposite. So this is our coordination factor. 1 foot scrunch, the other one release. And there are a lot of studies have shown that people who work their toes and feet, it helps their cognitive abilities. So you're working on not getting dementia. And if you have a bit of memory loss, this will help you. All right, that's great. So now we're going to stand up. This is another part of our training. Even if you're a professional hockey player, you want to get up off the ground and preferably don't fall down. You'll score more goals if you don't fall down. But if you can come like this on the right side, knees on top of each other, left hand on the floor, just lift up only an inch or two and bring the left knee around. And notice how easy that was. Okay, and then we'll just curl the toes and stand. That's exercises also, that way of getting up is a dynamic neuromuscular stabilization exercise developed by Kohler. And he has worked with a lot of professional athletes to try to help them not get hurt. Okay, so next we're doing our deadlifts. So if you could get a heavy weight according to you. I like to do deadlifts. I find when people do squats, there's a lot of fluctuation of the hips and knees, and people end up often getting injured. So my preference is we need to get our legs strengthening, and deadlifts, full body strengthening. Just what caution, you don't want to do this, like not knees forward, because that puts pressure in the kneecap. You always initiate by bracing your abs, setting your chin position, hip hinge back a little, and keep hinging back as you do the lift. Today we're going to do multiple angles. So the center position, the feet are just slightly wider than hips, and toes slightly angled out. Here, both hands holding onto the weight. So you can use a dumbbell, hold on to the ends of the dumbbell. A kettlebell is really easy to grip. Keep the chin tucked, brace your abs, hip hinge back. At the bottom, think of pressing your feet through the floor. If you can have that concept, push the feet through the floor and stand all the way up. Make sure you keep the chin tucked in. Your head shouldn't be bobbing around. We're going to be doing sets of 25. Keep your awareness of pressing the feet through the floor. Chin tucked. Okay, and now rest and weight down. That was great. And walking a bit forward and backwards. So next two sets will be a wider stance. And to help build up for more rotational forces, right? We're going to have only one hand holding onto the weight. Left hand holds onto the weight. The palm should be facing forward. The palm is facing forward, so that externally rotates the shoulder. Be careful, don't lean to the side. Your job is to keep yourself centered to strengthen your core stabilizers. Left arm, keep the chin tucked and hip hinge. Just keep your awareness of staying centered. Here I'm counting 15. Okay, rest. And we'll just stay, right hand. Okay, palm is facing forward. Keep the chin tucked. Stay centered with your body. And don't lean down to the right. Notice your hips will want to shift to the left. So the hips are going directly forward and back in the middle. Weight down and rest. Okay, and now the protocol that we use for our training programs has been researched and shown to help prevent sarcopenia. So that's why we do this many reps and sets. Okay, and sarcopenia is loss of muscle and function. Like not just that you're weak, but you can't get out of a chair anymore. That's the loss of function. We're doing one last set here, 25. Again, feet are slightly angled out, more narrow stance this time. This time I'm to focus on the abs. So when you go hip hinge, that's really good. And you engage your glutes, that's perfect. But at the same time, glutes engage and lower abs engage like this to keep your spine in neutral angle. Okay, here we go. Both hands hold on. Chin is tucked, brace your abs. Hip hinge, glutes, lower abs, exhale. Hip hinge, glutes, lower back, lower abs, exhale. Your inhale will automatically occur. Stand all the way up. And rest. Great, and now we'll put that weight away. Okay, so today, for the upper body strengthening main exercise will be the chest press. So some people, you might prefer to do this on the floor. I have a weight bench, so I'm going to use my bench. It allows you, when you use a bench, you have more core integrated and glutes. We're always looking for better and stronger hips. Okay, so I'm just taking a moment here. I have to move a couple things around. Yeah, so for most people, So if you want to, you can do this lying down on a couch. So you would lie down on the couch on your back, and you'll have one leg off, and the lifting arm will be the arm that's not on the couch, obviously. Or like if that works pretty well. Like the couches work well. I do that with a lot of people. Depends on your height though. Okay. Good. So we're going to be doing 3 sets of 15 reps. You can pick your best weight accordingly. So why we do this one leg off, this angle, Stuart McGill, back care, world-renowned back care expert. This was one of his suggestions, and it helps, again, rotational core work, similar to what we just did with the deadlifts with one arm. So you lie down like this, and you'll have one leg off, and the lifting arm is the same with the outside of the couch. So if you want to, you can set yourself up like that. We're starting with left arm pressing. Just if you're not on the floor, then be sure you don't let the elbow go too low. You don't want your elbow to hang way down. The elbow would be just along the side, but about 6 inches from the side. So we're starting with left arm straight up, keep the chin tucked. People on the floor, you bring the elbow to the floor and press. The people on the bench or couch, your elbow will just go down about bench height, not way down, because that puts too much force across the front of your shoulder joint. So you don't have to go way down. Okay, switch to the right arm. So people on the floor, right leg is straight and left leg is bent. Okay, right arm pressing, keep the chin toward the throat and head centered. Elbow down to the floor or just along your side here. But you see this angle, the elbow should be about 6 inches to the side. If you have the elbow right by the side, it'll pinch your rotator cuff. Similarly, if the elbow is too wide, the arm near humerus can't rotate very well in the rotator cuff, and it gets impinged and causes often damage to the rotator cuff joint. Okay, switch. So left hand pressing, left leg is straight, right leg bent, chin toward the throat. Breathing is exhale as you press. Keep the chin tucked in. Okay, right arm, right leg straight, left leg is bent, chin is tucked in. The wrist should be always directly over the elbow joint. When you bring the weight down, don't let the weight drop into your chest. Okay, chin down, elbow down, exhale as we press. And keep the weight over the elbow, not falling into your stomach. Now, another benefit to this offset position is it allows free movement of your shoulder blade. When you're flat on the floor or middle on the bench, the shoulder blades are restricted, which is they shouldn't move. So if you're flat on the floor, your shoulder blades should not move. If you're halfway off like I am, then you have a better range through your shoulder blade. Now, in saying that, as you're pressing, left arm press, left leg straight, right leg bend. The humerus, your rotator cuff joint. That's the arm bone is in the rotator cuff. That joint, as you're pushing, it shouldn't be overextended. So even though you straighten the arm, you're trying to straighten the elbow, your arm bone stays back in the rotator cuff joint. Don't let it pop out. That's when people dislocate a shoulder. And some people, you might have dislocated shoulders. Oh, if you have a lot of crunching and crackling in your joint, that's okay. Don't worry. I've seen many people who've had a lot of crunching and crackling, and over time they clear up. But you do have to be consistent with your training. They won't just go away in general. Okay, right side, right leg straight. Okay, so now this is a good view here. So when you're pressing like this, you don't want to go like that. Like, don't pop the shoulder up. Your shoulders should stay on the floor or stay in line with the bench, but your arm will straighten, not lifting like that. Okay, here we go. Right arm, last set here. Okay, and rest. And be sure when you put the weight down on the floor, I would just take the weight off and roll to the side. If you're on a bench, then you'll have to sit up, but do brace your abs as you do that. Okay, now we'll put the weight down. And if you want to walk around for a moment, I'm just going to describe the next exercise. And okay. So our feature exercise this week is for the obturator internus muscle. It's a hip muscle that externally rotates. That means it rotates the leg out and abducts the leg, lifts the leg to the side. And it sits in the belly of the pelvic bowl, or inside the pelvic bowl, I mean. And often it leads to when it's tight or weak, leads to sciatic pain, can contribute to herniated discs. A study where they did competitive athletes, the researchers studied, and they found that the athletes who had 20% of the amount of force they can apply was less than 20% of their body weight. And they did a measurement for strengthening the obturator internus muscle, the one I'm speaking about. And the people who couldn't apply enough force were more prone to knee and ankle injuries and had 7 times more ACL tears that season. So this is a really important muscle and also contributes significantly to sciatica and other spinal injuries, spinal fractures, herniated discs, you name it. So we want to strengthen the internal and external rotators, but there are particular angles that we're going to do to best have access to the obturator internus. It's similar to the rotator cuff muscles. When your arm, so here, you rotate your arm like this in and out. You do the same thing. Your hip rotates in and out like that, the leg. So obturator internus helps with that. So we're going to do 2 different angles. One is external rotation and also internal rotation. The first one, so side lying leg raise, people talk about all the time. But this one is best if you can do it on a couch. So that's why I have the bench over here. But you would lie on the side, like this, knees on top of each other. And the best angle, if you can do straight back like that if you're on the floor. But if you're on the bench, see, knees are over top each other, and you keep knees always stay like that over top, but you straighten the top leg, and the top leg is flexed. We're going to just do sets of 10. Ideally, you do 3 sets of 15. I'm going to do 1 set of 10, so you can join me if you want to. But you go to a lift, and you lift to a 45-degree angle. You know, if you go too high, you'll lose the force. Like it gets easy, so you only lift up to 45. The knee should be straight. And your spine shouldn't be twisted, like don't lean back with your shoulders. The shoulders should be vertically on top of each other. And also the pelvis right here, the hips are vertically on top of each other. And I would have a pillow for your head. The C-foot is flexed so you don't twist your knee and don't twist your ankle joint. Okay, so now we're going to go other direction. We always make sure we even ourselves out. So you do one leg. The recommended is 3 sets of 15. I'm going to do 1 set of 10 on each side. Okay, knees are on top leg is straight, foot flexed, and you lift, keep the knee straight, lift to 45, and you'll feel this on the outside of your hip, so your hip external rotators. At first, you know, you may not even be able to do 5, but if you just practice regularly, you'll get strong pretty fast. We do be precise though about the angles. Okay, now we're going to do internal rotation. So internal rotation is this. So like that, so you rotate your leg in and out. It's not lifting the leg like this side to side. That's not what I'm talking about. I mean like this, that your leg is turning inside your hip joint, okay? So this is for internal rotation. So again, you're lying on the side, hips on top of each other. This top leg, to stabilize your hips, I like to have that leg straight like that with the foot flexed. This leg is knee over hip. So your knee stays here, and this is a 90-degree angle at the knee. Now, a lot of people are really loose. So depending on you, right, I wouldn't, wherever you are, you don't really want your foot to go all the way to the floor. Like that, usually that's like too much, there's laxity in your joint. The joint is like weak and too loose. You want muscles that move the bones around that are strong. Okay, and now the other side. Making sure that you're, you know, best if you have your head so that your spine can be straight, top leg is straight, right, and flexed. And bottom leg, internal rotations. You can see I'm not moving the leg up and down. You're rotating your femur, that's your leg bone, is rotating in and out in the socket of your hip joint. So 3 sets of 15. I would do the first one, 3 sets 15, second one, 3 sets 15. If you practice that, well, first of all, if you have stronger, you'll be less likely to have ACL tears and other injuries. So thanks for coming. And yeah, do enjoy our classes if you want to join our 1-hour sessions as well. Have a good week. And those of you who are continuing, back to next exercise. So we just worked on the hips. Now we're going to work on the rotator cuff. Today you just need one light weight, and I mean a really light one. So here I'm just going to use like a 2 pound or 3 pound, even 1 pound for some people. So we're going to do, it's going to be 2 different exercises. One is like this, the arm starts facing you, your palm is facing you, and you reach up. But at the top, your arm is straight. Here the palm is facing back, okay? So here my palm is facing my leg. Up here my palm is facing you. So you're rotating, like I said, you're rotating your shoulder blade as you're lifting the arm. For the first, you might not even use a weight. We're just going to do a set of 10 on each side. So here I'm starting with the left arm, straight, really stiff arm, and then internal and external rotation. So this is kind of similar to what we just did with our hips, actually. You're internally rotating your humerus bone, and you're internally and externally rotating the shoulder blade. Just keep the elbow straight. If you bend the elbow, that internally rotates your shoulder, Last one. Okay, switch. And rest. Okay, and lastly, take the feet a little wider. So this is just a lateral raise, but the arm goes slightly behind you like this and out to the side. So when you're here, the palm is always facing down, okay? But I like to have feet wider, straight elbow again. So you're moving from the shoulder blade only up as high as the shoulder. You don't have to go higher with this. Keep the arm really stiff. Okay, and switch. Stiff elbow. And if it's painful, you can just instead hold. You don't have to do reps. Again, over time, we're working on all these different joint systems. It's really very exciting. Thank you for coming. And yeah, please join us again next time. Have a great week.